So it's great to be here today, and I'd like to acknowledge I'm on the land of the Guyabul and Jarrawa peoples of the Waka Waka Nation, and welcome everyone here today. As Kylie said, this is general advice today. It's not to be taken as individual legal advice in any way, shape or form. And I would always advise you to get advice that's specific to your business from a quality consultant. There's a lot of people getting around in the sector at the moment calling themselves consultants, and some of whom have no experience in the disability sector, which is interesting. But yes, I am an NDIS quality auditor, and I do a lot of consulting with businesses, and I'll mention at the end the sort of things that I could do to assist you if you were interested in chatting to me. So today we're going to talk about NDIS registration. Thanks, Deb. I have my assistant helping me with the slides today. So these are the sort of things we're going to talk about today. Why should your business become registered or not? What are the steps for registration? What are the requirements for registration? And what are the pros and cons of registration? And we had hoped that we'd be further along with the government understanding about registration, but that has not happened yet. So I'll just go back to previous one. Yeah. So the next slide, we just talked about the NDIS, what it's for, and it's basically to provide services to those people who need them. No worries, Deb. So we would all know about the reasonable necessary support, and that it's set up as a legislative scheme. Yes, notes will be made available, and also an edited part of the recording, or the PowerPoint as well will be made available to you.
I think we're on to the next slide, Deb.
There we go. Yep. So there's also some reforms happening at the moment. So a new quality and safeguarding framework is currently being developed. So it's supposed to improve the quality and safety of supports, and they did put that out to tender to some select groups. And it hasn't been announced yet who has the tender to help develop the quality and safeguarding framework. So that will impact upon the probably the practice standards, as well as potentially the code of conduct. So we'll wait and see what happens there. Now, it's still on their roadmap for reform, still has the mandatory registration for SIL, support coordination and platform providers. It still says on their roadmap to reform that it could potentially start from the 1st of July. I would be very surprised if it's this time in June and there's been no announcement made that that's the case. And what I think will happen anyway, because of the number of SILs, support coordination and platform providers that there are, would have to be a long transition, like a 5-year transition, because they would all need to be audited, and that all takes time. And currently we have 1,400 quality auditors in Australia. That's it. So, and of course, a limited number of approved quality audit companies as well that hire those auditors as consultants mainly. Okay, we'll go to the next slide. So at the moment, these are the services that must be registered. So the first one is specialist disability accommodation, SDAs. The second one is specialist behaviour support. So that's the companies like psychologists that do the positive behaviour support plans. The next one is any services that wish to be using NDIA managed funding. So if a participant is funded through the NDIA, so that means not plan managed or not self-managed, then they can only contract to registered providers. The other one is plan management services. So they have to be registered. Having said that, their registration is a little bit different because there are sort of tiers to the registration, and they're really looking at financial controls, etc., more than one-on-one support, because plan management isn't one-on-one support. And then, of course, services delivering high intensity daily personal activities must be registered under the specific registration group 0104, and they need to have the type of support that they're delivering listed on their registration. So these are the following that are considered high intensity daily personal activities, and you often will see that term shortened to HIDPA. So if you ever see that, this is what they're talking about: complex bowel care, enteral feeding and management, tracheostomy management, urinary catheter management, ventilator management, subcutaneous injections, and that includes diabetes management, complex wound management. So currently they're the ones, they are the type of supports that classify under high intensity daily personal activities. And there's a lot of requirements around this support, including that registered nurses are required to train and supervise staff in these support categories. So currently they are the types of services that must be registered. Okay, we'll go to the next slide. So why become a registered provider if you're not a registered provider? So access to funding is probably one of the biggest reasons people decide to become a registered provider. So as I stated, unregistered providers can only utilise funding for participants who are plan managed or self-managed. And if a participant is NDIA managed, they have to use registered providers. So NDIA managed plans require the use of providers that have met the necessary standards and been approved by the NDIS Quality and Safeguards Commission. So that's the commission that will decide who meets the registration requirements and who doesn't. I will say here, though, plans can have different types of management for different types of funding. So I can remember a client who was NDIA managed because she was actually under involuntary treatment orders under the Mental Health Act, which is really interesting when you have the Mental Health Act versus the NDIA Act, which talks about choice and control, but they're saying this is an involuntary treatment order or forensic order, for example, under mental health. It's really interesting. But she wanted to take part in some art therapy or some other community-based therapy that was not a registered provider. And in her plan, we were able to have that part of the plan, I think it was capacity building funding, that could be plan managed, and the rest of the plan was still NDIA managed. So sometimes you will see that they will split the plan, or they used to. But as soon as you become a registered provider for the different types of services, if it matches the participants' plan and they're NDIA managed, then you will be able to provide those supports. There is a school of thought that talks about the credibility. So that being registered enhances your credibility and trustworthiness. It can be a marketing point. And useful to demonstrate that your service is compliant, that you are a registered provider. But there's a big note here, and you might have seen recently there's been some cases where services got into a lot of trouble in how they marketed themselves. So marketing is required to be carefully worded to avoid penalties. So the NDIS Quality and Safeguards Commission have recently taken action against providers with misleading or false representations about the NDIS registration and product endorsements. And the ACCC are also taking active interest in this area. So what that means is accurate and transparent marketing is required. So there is a lot of information on what you can and cannot say. You can, of course, use the I love NDIS or other things like that. But what these services were doing was saying that their products or services were NDIS endorsed, and of course they're not. if you're a registered provider, you've just been registered. The NDIA are not endorsing any services or products. So it is important, and it is important under consumer law as well, that you ensure that you totally understand and your service understands what your marketing claims are allowed to do. I've been dismayed by some of the marketing I've seen from some consultants who are promising amounts, funding amounts, things like that, which of course is not possible to do. Excuse my dogs. Opportunities. There are increased opportunities to support individuals with disabilities once you are registered. So that means that you'll be able to provide services for participants regardless of how their funding is managed. So we'll go to the next slide now. So how does the NDIS Quality and Safeguards Commission approve providers? So it is a multi-step approach. So the first thing they do is assess an application. So you do an online application. Then and one of the AQA or approved quality auditing companies will conduct an audit of your service, and they will verify your suitability to deliver services. The Commission will do that based on the audit report on your application and the information that you've given to them. We'll go to the next slide. So with your application, it's an online application, and you'll need to include your organisational structure. So that includes who your directors are, and they talk about your key personnel. So key personnel, the definition is in the Act for key personnel, and they talk about it being a risk assessed role, but basically it's anyone in your organisation that has effective control over the operations. So that's your directors. If you're a company, it's your board of management or board of directors. It's your senior management, CEO, CFO, COO, anyone that basically is in control and is making those high level decisions are key personnel. So information has to be put on about them in your application, including whether there's any past convictions or enforcement actions against them, what their education is, what their experience is. So all of that needs to be put into your application. You need to list the specific NDIS supports and services you're intending to provide, because that impacts on who your key personnel are. For example, when we talked about the high intensity daily activities, with the need to have an RN on staff. Also, there is a self-assessment that you carry out against the practice standards to say how well your service is doing against the practice standards. So the Commission will then assess the application for suitability, but I will say this, a large number of applications have been refused due to identical or very similar, and I've said they're purchased, self-assessment responses. So in the recent quarter, there was 1,218 refusals for registration. What this means is some people have just gone out to some of these consultants and have purchased not only the policies and procedures for their organisation, but they've also purchased a self-assessment, which seems quite crazy. And they've answered every practice standard in exactly the same way, and they've just put that in without looking at their individual business. I would highly recommend you do not do this, because basically, even if that was passed, which it will no longer be by the Commission, you will not pass the audit anyway if you just have purchased products and not tailored them to your specific organisation. So that's where we're currently at there. So getting ready for registration, and these are sound business practices regardless. If you take nothing out of today's presentation, I would like you to really pay attention to this slide, because this is the nuts and bolts of suggestions to make your business really great, regardless of whether you become a registered provider or not. And after having done consultancy work and worked with services, some that have got quality systems and continuous improvement and some that haven't, there is a world of difference with businesses that don't have good quality management and don't have good continuous improvement, even in such things, and we will talk about this, but as version control of forms and documents. That to me is a huge indicator of how well organised a service is. So you need to ensure you have a quality system in place that promotes continuous improvement. So you may have seen the continuous improvement cycle, where you plan, you do, you review, and you act. And it's really important that everything in your business is being carried out within a continuous improvement cycle. So complaints and feedback, incident management and prevention of abuse and neglect must be part of your quality system. These are just to name a few. This is the basics. There's a whole range of other policies and procedures that you need to meet the practice standards, the practice frameworks and the code of conduct. Internal audits are the key. You need to show your schedule for your internal audits and written evidence that those audits have been carried out. The written evidence should say when they were carried out, who did the audit, what the findings were, and then what has happened since then to ensure that the findings of the audit have been addressed. The NDIS Code of Conduct is mandatory for all providers, whether you're registered or unregistered. So everyone should understand and be compliant with the NDIS Code of Conduct, regardless of registration. And every employee should be able to know what the Code of Conduct says and be able to say how they are meeting the Code of Conduct themselves. HR good practice is key, and from all indications, this is going to be a strengthened requirement under the new practice standards, where they really look at worker screening, referee checks and training. And as a consultant and auditor, this is where a lot of services are failing. If you can't show referee checks for your employees, if you can't show that they've undertaken the NDIS orientation, online orientation, that they've got appropriate worker screening, and that they have ongoing training and professional development, and that they're trained before working with participants, then that will be a fail in the audit. You need to ensure your policies and procedures, documentation and files are tailored to your business, available to all. So there's no point having all policies and procedures and no one can access them. I've seen that a lot too. And they need to be up to date and implemented. And part of having your internal audit schedule is that you go through and check the policy and procedure. So they need to marry up with your processes. And this is another big thing I've seen, where a service might have a policy and procedure, but what they're actually doing on the ground has no relationship to that policy or procedure, which sort of defeats the purpose of even having them. So like I say to services, they're not just to sit on the shelf, they're to be actually utilised on a daily basis by everyone in the organisation to ensure that you're doing what you said you're going to do. So quality audits, this is going through the different types of audit that there are. As we've discussed, the Commission audits providers through approved quality auditor companies. They're called AQAs. So there's a list of them on the Commission website. They are the only companies that are allowed to undertake audits within the NDIS space. So there's a list of those companies, and they themselves are audited under JASANS to ensure that they're compliant. So no other company can do your audit for you. Consultants can come, like myself, and other companies can come in and do internal audits or help you prepare for your audits, but unless we're working through an AQA that's listed, we cannot do your official audit. So audits are independent and they are required for you to be a registered NDIS provider. The first audit is a verification or certification audit, depending on what you're getting audit for. And the initial scope of audit provided by the NDIS Commission will tell you what type of audit you need, but these are the general rules. And this is, I've taken this directly from NDIS website, so I'm making sure I'm telling you exactly the right thing. So a verification audit is for low risk, low complexity supports and services. A certification audit is for higher risk supports and services. Once you become registered, you often will have a midterm audit. It's for providers who initially completed a certification audit, and then 18 months into the registration, we come back to do a midterm audit. That is especially for services who may have started as a registered provider but have no clients. So what that means is we can come and do a certification audit at the start, but because there's no participants yet, because they're not registered yet, we just see all the policies and procedures, how everything's set up, and then we come back after 18 months to see how the participants have been. We can see the files, we can go through and see how everything's working. A conditional audit may be required by the NDIS Commission during your registration period. So it could say you're allowed to provide supports under these codes, but maybe not under some other codes until you have proven yourselves. They could have different conditions on the audit. An out-of-cycle audit may be needed when you want to change the supports and services you provide during a registration period. So you can only provide supports for the listed services on your registration. So sometimes people say, well, actually now we want to move into support coordination, or we want to move into some other form of registration. We want to start doing the high intensity daily personal activity support. We want to become, have part of our service to do another type of support. Then you might need to be re-audited to enable you to get those added to your scope of registration. So talk about a scope of registration, which is your list of registered services that you are accredited to provide. There is a registration group or support classes table. It has details of which audit is required for the supports and services you will provide. So there is a lot of information on the Commission website in regards to quality audits. So this today is just an overview, but I would say if you are interested, go in and really have a good look and to get more information as to what type of audit you would need for what sort of service you're looking at. So certification audits, there's 2 stages. So the first stage is a desktop audit. And this is where the auditor will ask for information and evidence, and it usually takes place off-site. And how we often do this stage 1 desktop audit is we often get a login to your system. That's why we can do it off-site. And we sit there with our spreadsheets, and we go through each of your policies and procedures. And what we're looking for there is to say, do your policies and procedures, do they meet the standards and the code of conduct? Are they compliant? And we go through and make sure that they are all compliant. The second stage is actually the on-site audit. So this is where we say, so stage 1, we've said, yes, your policies and procedures look great. They meet the requirements. Stage 2 is we're checking to see that you're actually doing those policies and procedures. And this is where a lot of services come undone, especially those that have just purchased policies and procedures, but haven't actually changed them to meet their own service and haven't changed them to show exactly what processes you might be doing on a day-to-day basis. And as an auditor, we become very good at looking at policies and procedures, and some of them I can tell where you purchased them from because no one has picked up on a certain spelling error or grammar error that's in those policies and procedures. I can tell if they were purchased before a certain year because they may not include changes such as waste management, disaster and emergency that was added in after 2021. I can usually tell what organisation those policies and procedures have been purchased from. And now one of the things that the Commission has asked auditors to do is to say to the service, who have you used as a consultant or who have you purchased these policies and procedures from, and get details in that regard. So with the on-site audit, so this is how we're trying to say, is the service doing what their policies and procedures say they're going to do? So we look at records. So in HR, that would be your onboarding records to make sure the referee checks have been done, the notes of the interview, to ensure that there's the certificate from the NDIS online orientation training, to look at what certificates the person has done or whether there's copies of those that are online. For example, we would look at service agreements for participants. We look at the onboarding information for participants. We look at case notes about how supports have been delivered to participants. We'll often visit sites and interview staff and participants. So in my role as consultant, I've done a lot of pre-audit audits of sills for companies all around Australia, where I've gone into the sills, the supported independent living houses, and undertaken basically a draft audit, looked at the environment, talked to participants, talked to staff, looked at all the records, and highlighted all those areas that have to be corrected before that site could pass an audit. We also do observations at the sites and look at a whole range of different indicators as to how the service is operating. So usually the stage 2 on-site audit should take place 3 months after the stage 1 audit is complete. So there was a bit of disruption to this with COVID. We had to change to some of the stage 2 audits going online. As far as like for a SIL audit, we'd have a worker with an iPad walking around, because the types of things we look at in the environment too is, you know, what information is on the walls? Is there good visual information for participants and staff about a whole range of things such as washing hands or infection control? Are there exits? Are the fire extinguishers serviced and up to date? There's a whole range of things that we're looking at that show how that service is meeting the standards, but it definitely has to be on site. And the latest advice from the Commission is that those on-site visits are mandatory for stage 2 of any of the certification audits. So the audit outcomes, there's an audit report that is produced, and it has a rating system that shows you how well you comply with each NDIS practice standard and quality indicator. So it breaks it down, and the ratings are submitted to the NDIS Commission. The rankings are 3, conforms with elements of best practice. 2, so 3 is the top. 3 is best practice. This is fantastic, and we love to see that as an auditor. 2 is conforms with NDIS practice standards. That is what most audits will have 2s, just to say yes, it's conforming. 1 is a minor non-conformity and 0 is a major non-conformity. So if you get a 0 rating in any of the areas, you have 3 months to fix the issue. Your registration won't progress until you've addressed the major non-conformity and successfully completed the quality audit. If you get a minor non-conformity rating in any of the areas, you have a longer time to fix the issue and you can continue with the registration process. Also, if you get 3 minor non-conformities in one area, it actually adds up to a major non-conformity. So I won't go into detail today because we don't have enough time, but there is a lot of ins and outs as to how we rate audits. For more information, you can see Annex B of the National Disability Insurance Scheme Approved Quality Auditors Scheme Guidelines 2018 or the NDIS Commission website. So I'll just direct you there for more information. If your application and audit is successful, then you will be issued with a certificate of registration, which outlines the services that you're registered to provide. It also has your registration period and any conditions that are on your registration. You must adhere to all conditions of registration, including the NDIS practice standards, the code of conduct, and also maintaining your audit certification at all times. So that includes doing the audits as directed. And this includes worker screening compliance, updating any changes in key personnel. So that's the people that are in effective control of your business, and applying to change the registration if you add new service offerings. So I have also seen that when I've gone into help a service or audit a service, that what they've got on their registration certificate, they're actually offering a range of different services, and they really need to update that ASAP. You also have a lot of reporting requirements to the Commission and to the NDIA, and the Commission also publishes a list of approved and registered service providers. I will, however, say they don't seem to update that in a timely manner, because there's another list they publish of banned services or banned providers that have orders to either cease in their lifetime from providing NDIS services or for a banning period like 6 months, 2 years, and a lot of those services are still on their list of approved and registered providers. So then, steps to becoming a registered provider. So it's really important that you understand the requirements. There is the NDIS Provider Toolkit online. There is a lot of information to help you. There really is. You need to have an ABN, of course, and you need to be able to demonstrate your ability to provide supports in the classes you're applying for. So make sure you understand the requirements in each of the classes of support you'd be looking to apply for. You need to meet the eligibility criteria and have the proper evidence, as we've discussed. You need to complete the online application form. It was through PRODA. It's now through the Commission, I think, that has changed. But you can find more information about that online. You need to provide necessary documentation, so proof of your qualifications of your key personnel, insurance, etc. Ensure you have the systems, policies and procedures in place to successfully pass an audit. So this includes a robust continuous improvement cycle and completing that self-assessment against the NDIS practice standards, and not one that you've just purchased. You need to complete it that relates to your business. All workers are required to be screened. Your application will be assessed by the NDIS Quality and Safeguards Commission, and you need to undergo an audit from an approved quality auditing company. If approved, you will receive your registration details, and then you can start to deliver services under the NDIS, but only under the service categories that you're registered for. So how does quality improve your business? Because one thing I will say as well, whether you're going to be registered or not, having better quality will improve your business, full stop. And it's something that we should all be aware of and really look, and because it improves it for everyone, for the participants, for your workers, for your management, for everyone. So adhering to NDIS standards and guidelines leads to better and safer outcomes for everyone. If you have your policies and procedures and systems and they're tailored to your organisation, as I've said, buying policies and procedures and not changing them is one of the main reasons that services fail audits. We see it all the time. So they're not window dressing, as I say, they are not to be left on the shelf. So for example, your organisational chart, where you map out what the roles are in your business. So it doesn't have individual names on it, but it's got roles. So the service manager role reports to this person, reports to this person. Like that should be changing all the time. You should be updating your organisational chart whenever there is a change in the structure of your organisation, in reporting lines or in new positions or in positions that are combined or folded. So really you should be on version controlling all your documents, and an auditor should be able to walk in and say, oh, you're up to version 32 of your organisational chart. So anyone should be able to walk in, pick up your policies and procedures and know exactly how your business operates. If they don't, then you either need to change your policies and procedures to reflect what you do on a day-to-day basis, or you need to change your processes to reflect what your procedures say. And just on that, policy says why you do something. So a policy says we are doing this to meet this requirement. And when I had policies and procedures, that at that time were over 6 or 7 different standards frameworks. So keep in mind, we're just talking about one standard framework here, but in the olden days, you could have multiple standard frameworks from state and federal government departments, from different funding bodies. We had multiple standard frameworks. So the policy would list at the start all of the standard frameworks, and then there was also a part with legislation, and it would list all of the legislation that also applied to that policy. So policy is why we do something. Then the procedure is how we do it. And if you keep that in mind, it makes it a lot easier, because you're saying, right, the policy is basically our general statement about what requirements we're meeting, and the procedure is our process, is actually step by step how we're going to meet those requirements. So you can maintain high quality service delivery through a robust quality management system. So that's where you have oversight across the entire organisation, where you're planning, where you're doing it, you're reviewing, and then you're acting to make changes. That quality management and continuous improvement cycle. And it means you have things like robust reporting in all areas. And that will also help your directors, or the people who have effective control of the business, have oversight that they need legally to have, whether it's your board of directors or a managing director or whoever it is. They need to have a quality management system that reports everything back to them. And one of the things I do is also provide training around NDIS director responsibilities. And that's a whole other topic that can go for 3 hours. And that's just touching the surface of all the responsibilities that a director of an NDIS business has in Australia. So version control, having a robust version control system, it improves all aspects of business and service delivery. This includes form and document registers and version control. So this is one of my pet peeves. And when you're an auditor and you come into a service or even doing consultancy and you say, right, where's this document? And people get online and it's such a mess. They might be using 2 or 3 different systems, and then there's a SharePoint, and then they've got things saved on their computer. No one knows what the latest version of a form is. No one knows what the latest version of a document. And how I think of it is, forms are the templates where you fill in information. So you're getting information, you have different areas. Documents do not have a space to fill in information. They are a set document. So your service agreement, for example, is a document and a form. It should have your set terms and conditions, which is a document, and then it should have a schedule, which you fill in and change for each person. But when I walk into a service and they don't have version control, that tells me a lot about that service. Because how can you run a proper service if no one even knows what version of a form they're up to, and where is it kept and how do you use it? So I used to have version control in a document register and a form register. I would have them hyperlinked to the latest version. So what I would ask everyone to do is not to save individual copies of forms and documents onto their computer to use or reuse, but to always go to that document, open it up, click on the hyperlink, and it'll take you to the latest version. And it'll also have the version number on there, so you can double check that you're using the latest version. And once again, you can see through that example that quality is everyone's business. It's not just the quality manager. Everyone has to be involved and understand why they're doing something. And I've seen some catastrophic results where the wrong form has been used or the wrong document has been used. When we're dealing with life or death issues, it's very important that we make sure we've got really good version control. So registration requirements, this is just another way of saying probably what I've said before, but you need to comply with the NDIS practice standards. You need to follow the NDIS code of conduct. So code of conduct for whether you're registered or unregistered, doesn't matter. Everyone needs to follow that. You need to have a good system for complaints, feedback, management and resolution. Complaints and feedback, management and resolution of those. You need to have a proper incident management system, no matter how you're doing that. It's about incident reporting and looking at the root causes, risk management, risk identification, and then being able to show what you've done to prevent that incident from happening again. And also having a very good system about notifying the NDIS for reportable incidents. So a lot of services have been in a lot of trouble for not reporting incidents within the time frames. So there are set time frames to report reportable incidents to the NDIS. And if that happens outside the time frames, you will be served with a please explain notice from the Commission to say, why didn't you report this within a timely manner? Ensuring staff working with the NDIS participants have the NDIS worker screening process completed, and there's evidence of that. Meeting behaviour support requirements if that's relevant to your business. Undergoing the audits that you require, and complying with all conditions stated on your certificate of registration. So as we said before, there will be different conditions on your certificate of registration. So just also going over those benefits, again, you can access all the funding for service delivery. It enables you to provide the essential support needed to individuals with disability. It will give you opportunities for business growth and development. It will give you continual improvement of business efficiency and continuous improvement measures. So it is a good way to really take your business to the next level. Even if you feel you're being made to do it, it is a really good way of ensuring that you're doing the right thing and that you are working in a continuous improvement framework. And it does give you a really good framework to do that in. And as we talked about, you can add the unique marketing points to your strategies to differentiate your business. So you can say we're NDIS registered. And future proofing, because as we mentioned before, there are several categories of service delivery that we believe will need to be registered in the future. We don't have the exact details, but as I said, it's still on their reform roadmap that SILs, support coordinators and platform providers will need to be registered. So you could get in ahead of the crowd and get that registration. If you're registered now, I believe there will be a fairly streamlined way for existing registered providers to be registered under the new quality framework when it comes out as well. So that might be something to consider as a good reason to look at being registered sooner rather than later. What are the downsides? Let's be transparent and honest. There are higher costs to being registered. And this has been something that smaller providers have often balked at because, as we know, the margins in the NDIS are not fantastic. And looking at the latest price guide, those margins are not improving at a time when all of the business costs are rising, whether it's insurance or utilities, rent, worker compliance, everything's gone up, but the funding has not. So for everyone, there are higher costs to being registered. There's ongoing audit and registration costs. So auditors have to be paid, and it's not a cheap exercise to be audited. And then there's the cost of having a quality management system. So, but I will say this, you do not need to pay to have all of these complicated online systems. I've seen some services that have just tied themselves in knots because they have this system for this and this system for this and this system for this, and the poor workers are having to use 5 or 6 different systems, online systems, which don't necessarily have the best outcome. And I've seen brilliant quality systems that have basically been run, especially for smaller providers, utilising spreadsheets and utilising, very simple databases. You do not have to have a really complicated online system. You just need something that's going to work and that everyone can access. In fact, sometimes the more complicated the systems are, the less people use them. There is stricter compliance in that once you are a registered provider, you have to meet more compliance than non-registered providers, including reporting. Now, there are, of course, recently the Commission have actually fined some unregistered providers for not complying with the Code of Conduct. So you still have some compliance issues, but of course, once you're registered, you have a higher level of compliance. There will be more paperwork in every aspect of your operation. However, the fact is going to lead to better service delivery and also better protection for everyone involved. I believe it's worth it. And with legal matters, there probably is a higher duty of care and legal considerations, including reporting issues once you are registered, which seems a bit counterintuitive, but that is the case. So unregistered providers need to follow the NDIS Code of Conduct. You still need to have an effective complaints management process. So you have to show that complaints are accepted, that they're acted on, that they're noted. You have to be compliant with all legislation, state and federal, that applies to them. And this is a bit of what I do in my director training, but this includes and is not limited to fair work. There's been a number of cases with fair work and disability services recently. All taxation, including the super guarantee and PAYG, work health and safety. Oh, and with fair work, there's been a number of services have to pay back millions of dollars in regards to incorrect on-call and overnight sleepover type allowances that they have not paid, and they've ended up having to pay back millions of dollars. Privacy laws. So the privacy laws are undergoing a huge transformation at the moment, and that includes cybersecurity. And because we're holding really personal data, often health data, you have a high level of privacy and cybersecurity requirements, and that's only going to get more and more onerous. So waste management and environmental concerns, services have been prosecuted as well under environmental laws, and that's one reason they added waste management to the practice standards in 2021. Copyright and IP laws are huge, including the use of ChatGPT and other AI, and also with privacy, cybersecurity. There's issues with sending information about clients offshore when a number of services are using offshore workers, and there's huge implications there about sending information offshore. And I'd advise everyone to go and check what privacy information you're giving to your participants and your workers, because there should be a privacy notice included in all induction and onboarding. And as we discussed before, there's marketing and consumer laws as well, that even if you're an unregistered provider, that you have to comply with. You need to have a system to ensure staff are trained and appropriate. So that's with all your checks and balances of staff. It's very important to do that. And you may have to become registered depending upon the reforms and how far they go. So it's just something to consider for the future. So warnings. Lawyers love warnings. Do not use policies and procedures that are not tailored to your particular business. They are worse than useless. They are dangerous. If they are not tailored to your business, then there's no point in even having them. And it's really important that all policies and procedures you have actually reflect what you do on a day-to-day basis. So I would say do not buy a business or package that includes a standard application for registration. If you do, you need to change it, or it will not be accepted. It will be rejected. They are not stupid, and they know when an application is exactly the same as the 1,280 other applications they've seen. Do not become a registered provider if you are the key person responsible and you don't understand your responsibilities. Some registered providers I've seen that have passed the stage 1 audit, so their policies and procedures are fine, then we come out on site and the key person responsible or the key people responsible have not got the slightest clue of how to apply the policies and procedures, or even what the policies and procedures are. It's an automatic fail. In fact, I've had to just leave it there and not even look at anything, because there's no point. If you say to someone, can you show me your policies and procedures? And they say, what are the policies and procedures? I don't know what to do with that. Do not use consultants who have had no experience in the sector. And if it's too good to be true, it probably is. So if people are saying, we guarantee you're going to get packages of $300,000 from the NDIS, that is not true. If they say we can do all of this work for $100 and guarantee you'll be registered, that is also not true. If you're unable or unwilling to work in a highly regulated business environment and with the policies and procedures that you abide by, then this may not be the sector for you. And I know that sounds harsh, but someone has to say it. And if you don't like reading policies and procedures, and if you don't like detail, and you don't like registers, and you don't like quality assurance, and that's you're in charge of a business, this may not be the sector for you to be in. And when I read all of the things saying, all you need is an ABN to be a disability service provider, not true. My name is Bronwyn. You can contact me through LinkedIn at Herbertson Hill Quality Auditing, or that's my phone number there. If you do want to discuss and get a quote for me to help your business in any way, please do so. And I would just say the fact you're here today doing this presentation is great. And of course, working with CheckUP and other organisations is another great thing you can do to ensure that you are doing the right thing and that your business can continue to grow in a really competent manner. So I'd like to thank you for having me here today, and to say to Kylie and Deb, if there's any questions, and if we can't get to questions today, we will definitely send them out to you.
Thanks, Bronwyn. That was great. Scary, but great in some respects. Well, not scary. Maybe scary is not the right word, but you know what I mean. And a couple of things, like I think if nothing else, like it's that great reminder about the difference between a policy and a procedure, I think was nice and clear, and that was great. And even the difference between a document and a form, because people often just use those interchangeably, I find as well. And probably, I reckon, my quote for the day is worse than useless, so, which is, yeah, probably very true. We do have one question already that was put into our Q&A, which was around from one of the participants who said that, so hang on one second, that's dropped. They have ceased providing plan management. So is there a way to update their registration, or do they just wait until their next audit for that to happen?
Yeah, ceasing to provide in an area it's less important than, of course, providing services in an area that you're not registered for. So one thing that auditors will always do at the start of each audit, they will say, okay, I'm just checking, these are the things you're registered for. Are you still providing in all of these areas? And that's your opportunity to say, no, we are no longer providing plan management. The auditor will make a note of that, and we'll put that through in their audit report that they would like to change their registration as well. And you can also, the service can also contact the Commission if they want to, but it's probably not as important to remove than it is to actually add. And I will also say I have seen a lot of services that at the start they added everything. So what that means is they can sometimes be paying for audits for services and things that they're not actually providing service in. So I would say to people, it is important to just be registered for what you're going to provide for, not be registered for everything.
So what you are definitely providing now, not what you think you might want to provide in the next 2 or 3 years, Bronwyn.
Absolutely. I think you're better off adding it as you go than just adding everything and then having to deal with that. Yeah.
Great. Someone's also asked, do we have any idea around when the NDIS forms will be announced, and what providers will now be required to become registered? And it is absolutely frustrating not knowing that, but I don't have a crystal ball. I don't think Bron has any additional inside information, Bronwyn, at this point.
No, it's still on their website as it's called the Reform Roadmap, and it still states that potentially from the 1st of July, they may be looking at the SILs, support coordinators and platform providers becoming registered. No other information has been given. As that date becomes closer, it seems to me that the start date even will be pushed out. And as I said, considering there's only 1,400 auditors trained in Australia, and we're looking at large numbers of support coordinators, SIL providers and platform managers, there would have to be, by my calculations, a 5-year transition to allow for all those audits to occur.
Yeah, I was actually speaking to a platform provider yesterday and just asked them what have they heard anything else, and what they're doing to prepare, and they're likewise frustrated to not have any further information at this point. But I guess their they're, what was I going to say? What they're up doing is that they're sort of basing scenarios. They've said, we're thinking about what happens if this is what it looks like, what happens if this is what it looks like, and starting to sort of get their ducks in a line, if you like, to hopefully respond as quickly as possible when we do have information that's coming out.
That is a really good idea for strategic planning for businesses, to have multiple scenarios. That is very, very good practice.
The person that asked that has said they'll be well and truly retired by then. So just hanging in there, or maybe it'll be the point where you go, this is the time to retire.
Absolutely.
Has anyone got, so that's all, oh, hang on. A sole trader support coordinator. So they're the CEO, CFO, etc. All of those roles. Years of experience as an employer of organisations that have gone through quality audits, but I'm confused about how my small one-person business will need to prepare for audit.
Look, they do talk about proportionality in the auditing as well, and support coordination obviously is not going to be as vigorous an audit as like the high intensity daily activities type of audit or the SIL audits. So it will be proportional to the types of services that are being developed. But what I will say is even a small service can have an excellent quality system. And in fact, sometimes the better ones I've seen have been small services because they are under the control. You can, once things get too big, they can get too unwieldy. When you've got thousands of employees and different offices and all sorts of things can happen. But a small service where you've got really good systems in place can pass an audit easier, sometimes easier, and be a better business as far as quality management, continuous improvement goes. So once again, it just comes down to having good policies and procedures and good systems in place.
So essentially, it's not like there's different or less. It's, well, not less, I guess, different. The same requirements are in place. It's just the scale of those documents.
That's right.
Would be
So you'd still have an
complexity.
incident management system. You just mightn't be getting many incidents.
Yeah.
Yeah, you'd still have a way to report things. You'd still have a way of doing your internal audits. So yeah, it's the same requirements, but it just wouldn't be on the same scale.
So there was a lot of interest in that question. It ticks boxes for people. Someone saying, I'm in the same position and confused as to what policies and procedures are needed and what systems for support coordination.
Yeah, so as we talked about, it's about having, you definitely need incident management, complaints and feedback management. You need to have good HR systems. You need to have good governance. It's basically what they can do is look at the practice standards. If you look at the practice standards and how they're broken up, you can see the different areas that they're asking you to meet. So the way I used to think about it too was about the worker journey. So, worker screening, referee check, onboarding and induction, supervision and performance appraisals of workers, and then how we do exiting of workers. And the same as a participant journey. I used to break up my systems with the participant journey. So how do we handle inquiries from new participants? How do we onboard participants and make sure they have all the information that they need, including especially external advocacy if they need it? How do they understand our complaints management? How do we show we're giving participants information in alternative formats if they need it? Then how do we monitor the services they're getting? How do we get do co-design with participants and show that? How do we ensure the services are meeting their needs and meeting their goals? And how do we review their services? And then how do we exit and transition a participant when they go to another service? Same as work health and safety. What are we doing with workplace health and safety? What are we doing with ensuring that governance of the organisation has oversight in all the areas we need to prove that we're meeting our directors' responsibilities, for example? So if you look at the practice standards and doing that self-assessment activity against the practice standards is a really good way of saying where is my business falling short and where do I actually need to put more attention to make sure that I'm actually meeting the requirements.
Wonderful. So that self-assessment is sort of a guide as well to help you know what should be in place.
Absolutely. And the NDIS Provider Toolkit online on the NDIS website is also another great resource. There are a lot of really good resources. The other resources you'll find from NDS, National Disability Services. They have some great resources to help people in this way as well. They're like, to me, they're the best peak body in the sector. And there's Queensland branch of that as well. But we're really lucky that we've got a lot of organisations and resources online that can really show you what does good look like, what is quality, what does quality look like in a service.
Wonderful. I'm just conscious of time, and sorry we have slipped over a little bit, but what we might do is try to pull together some of those links and to resources and guides to send out to people that have come and those that couldn't make it today. And Bronwyn, happy to maybe see if we can work with you as well to particularly something that a quick checklist or something that we can pull together specifically for these smaller providers, sole traders and smaller providers that yeah, unsure where to even start and what needs to be what do they need to get started on this journey. So if there's no other, thank you, Jane's popped a little bit of information in the chat already, but and we'll make sure we add all of that stuff to any resources. Any last quick question before we say goodbye and let you get on with the rest of the day? No, I think we're good. So we appreciate you. Thanks for coming. Hopefully you found that useful, and we will look to get information out to you early next week. We'll make sure we edit out the irrelevant pieces of me probably mostly chatting and get you just the useful information back out on video. So thanks everyone. I hope you have a great rest of the day.
Thanks.
Cheers.
Bye everyone.
Thanks.